Hello everyone, today I will talk about XYY syndrome from my cytogenetic report. So this is journal from the Mobility and 47 XYY syndrome, a nationwide epidemiological studies of hospital diagnosis and medication use. This is the content, the introduction until the conclusion will be discussed here. For the introduction, this is about the kids that have the XYY syndrome or Jacquet syndrome has been estimated to affect 1 over 1,000 male births. This is make the 47 XYY syndrome one of the common diseases in the world. This shows the karyotype of the abnormalities XYY males that they have the extra Y chromosome and the sex chromosome. The syndrome is the scientific abbreviation of the sex chromosome abnormality in the male caused by non-disjunction of paternal gametes during the meiosis II, or it may happen with phostogastric mitosis. This picture is about the non-disjunctions occurs. The problem statement for this studies is the diagnosis have been delayed at the median age of the 15 years old. Some of them have been diagnosed at a very late age, so this is very harmful for XYY syndrome because they may face the mental illness, language disorder, and also the reduced motor skills and will reduce the academic achievements. The importance of this study is because the few studies from the UK and Denmark reported that these male syndromes XYY significantly increase in the mortality because of the effect of the health and outcomes of dysfunction hormonal and organs. There have three methods and materials that been used in these studies. First is the data was been taken on the person that registers on having 47 symptoms. The hospital diagnosed and analyzed the data by using negative binomial regressions, which is like the pictures here, and rate ratio IRS. And the third one is the hospital prescribed the medical diagnosis data being presented in form of hazard ratio graph based on this graph. Findings: 251 cases have been analyzed. The percentage of men referred to the hospital is inversely proportional to the age. Diagnosis shows that significant increase risk on they have cognitional malformations, genetic disorder, neurological disorder, and also the skin diseases. They also have impact on specific medications because of these disorders. What is the discussion on these findings? According to the study, testosterone hormone in XYY males can be higher or similar in normal persons, meaning that even though they have the same quantities of the testosterone in their sperms, but the quality is different. Maybe some of them will face the infertility. Besides that, the XYY male have an ability to having a risk on the malformation related to circulatory, genitourinary system, including with undescending testes. And the third one is XYY males have negative impact on their cognitive abilities, including the speech, motor skill, behavior problem, and also leads to reduction in educational achievement. So this is some of the organs that they have abnormalities in XYY males. They have the large stage, wide eye space eyes, and they have the flat feet here and flat fingers. They have a big head, macrophyllene, and also the abnormalities in their spine and back. So the presence of extra Y chromosome leads to the shock gene in XYY affect the increase of height of the person. XYY males have elevated growth rate during the adolescence, and elbow height are typically around the 70 cm higher than expected. High stature is described by the illusion additional copies of shock gene and probability other stature genes. As a conclusion, increased knowledge in a clinical systematic multi-gene treatment combination XYY males ovulation therapy may enhance the both long-term health result and socio-academic profile from the XYY male syndromes. So, the diagnosis from the early stage is very important, especially during the pregnancy. Help the parents to detect the abnormalities in baby early in the mother placenta by undergo the amniotic process. And the second method is using detection of chloranic villi, which is the tiny finger-shaped placenta during the biopsy. So this method can give the parents to make a conscious or more rational decision about the continuation of the pregnancy. So this is all about the XYY genes. Thank you for listening.